There we go. Over to you.
All right. Hello, everybody. My name is Sarah Walton. I'm a physiotherapist here at Gold Coast University Hospital. Firstly, I just really wanted to thank Stacey for this opportunity to provide you all some education about some respiratory muscle symptoms. So what we're going to do is I'm just going to very quickly share my screen here, and I'll give you a little bit of information about my background, and I will just share that now. And I will just see if I can slideshow. All right, so as I said before, I'm a physiotherapist here at Gold Coast University, and I've been a physiotherapist for about 7 years now, and I've worked with mostly with MND patients across the acute, either neurology and also respiratory wards. So during my experience as a physiotherapist, I've developed a great interest in respiratory physio and providing education to patients. And I've had experience over in Western Australia, over in the UK in London, and now more recently Queensland. So I've been here for about 2 years now, and I did reach out to MND Queensland as having patients here at the hospital with MND. I've been learning a lot more about this great organisation, so I just wanted to see if I could be involved in any way. So I'm very grateful for this opportunity to be speaking to you all today. I'm going to be covering respiratory symptom management, and as you all know, there's a great variability with MND, and so you will all have a different journey, you all have different symptoms and different needs. So it is really important to speak to a health professional so you are able to get a tailored management plan for any symptoms that you're experiencing. But the information I'm going to be providing today is just some general information that hopefully, if it's not relevant to you now, it may be in the future, but hopefully you can take something away from it that's going to help you. And at the end, we will have a Q&A, so I will do my best to answer your questions. So I'm just going to briefly touch on the respiratory muscles and what they are. I'm just going to talk about a few signs and symptoms that you may experience when you have some respiratory muscle weakness, how that's relevant to sleep and maybe waking up in the middle of the night, lung function testing, cough strength and what some options are for treatment, and non-invasive ventilation. So what are respiratory muscles? And by respiratory muscles, I mean what are muscles that we use to help us breathe. So these were just a few diagrams that I actually found with the MND website. So I thought it would be more applicable for you if you have actually come across these pictures before, so we can talk about them a little bit. So when we breathe, we use muscles and mostly the diaphragm when we breathe. So you can see here in the picture, the diaphragm does sit below our lungs. So when we breathe in, the diaphragm will actually move down, and that allows our ribs to also move out. And what we do is we take in a deep breath as those lungs fill up with air. And the reason why we take in the deep breath in, we'll breathe in and out, is to breathe in oxygen within the air, which allows oxygen to be absorbed into our blood, which we need. And when we breathe out, that diaphragm relaxes, and as a result, we can breathe out carbon dioxide. So during the day, we may also use other muscles. So our diaphragm is the main one, but we have muscles in between our ribs, and we can also use muscles in our neck that can help us to breathe in, especially during the day and when we might be being a little bit more physically active. So what are some signs and symptoms of breathing muscle weakness, or when our muscles are maybe getting a little bit weaker? So again, it's very important to remember that the variability within MND it varies between every person. So as the occupationer has said in a previous webinar, that there's not one quick fix for everybody, and everybody may experience different symptoms and different signs of this. So this is just some generic examples of what it may look like. But again, it is really important to discuss this with your GP or your neurologist or a respiratory doctor if you have one, just so you're kind of aware of maybe what some of the symptoms would be. So some symptoms that are probably more common than others are the ones that I've just put in bold here, because they can often be some of the first signs that we notice when you are experiencing or when those muscles become weak, because we know with MND it's that the muscles become weaker, and so as a result you may find that you may be waking up in the middle of the night, you may experience some fatigue, and often sometimes morning headaches can be a big indicator as well if that's currently happening. Some other symptoms that I'm going to be talking about today is shortness of breath, and also cough, so the ability for us to clear any phlegm that's in our lungs. And a few other signs and symptoms could be shallow breathing. Maybe we use more tummy breathing rather than in our rib cage. Also some poor appetite or loss of concentration and memory. And I will move on. So relevance to sleep disturbance. It's one of those things when we have those muscles becoming a little bit weaker. Again, like I said earlier, you may find that you are waking up in the middle of the night, and some people may have difficulty laying down flat. So when we are in different positions, I'll go over this a little bit later, but our lungs will allow us to breathe a little bit easier in different positions, and some people may find laying down flat more difficult. Some important strategies that I've found with some of my patients that have been helpful is positioning. So especially when you are trying to sleep, often propping ourselves up with a few pillows can be helpful under our neck or the head. Alternate side lying can be really helpful. And I know some people, again, this is not everybody because everybody is very different. So some people have issues with saliva management when they're trying to sleep. And so sometimes laying side to side can also be very beneficial in order to help you sleep. And some people as well may find that sitting up in the recliner chair can be beneficial, as rather than laying down in a very flat position, it allows us to be propped up a little bit, but also well supported. So you do want to make sure that you're well supported when sleeping. I'll go over this a little bit later on as well, but often you may find that you might not be waking up as fresh in the mornings. And again, that was one of those signs, like a fatigue or the morning headaches. And I'll be going over NIV and how that may help with sleep a little bit later on. So fatigue, as I said earlier, is one of quite a significant symptom that often patients complain of or do note when they're having any respiratory muscle weakness. And you may find that the fatigue may be a general fatigue or just a reduced ability to do things that you want to do, or even an exercise tolerance, so maybe not being able to walk as far as you usually would do. It's important to consider, again, that fatigue within itself is quite a big topic. So there can be lots of different causes of fatigue, not only just sleep disturbance, but also inadequate nutrition or stress or inability to participate. So there are lots of different factors. So again, this is just a few different strategies that may be helpful, but again, not tailored to everybody, because as you all know, you're all your own person and you will all have different symptoms. So this is just some strategies that I have found that some of my patients have found beneficial, and that is that you really need to listen to your body. So as you all know, you all know your body's better than anybody else. So it's important to listen to your body and potentially save your energy for things that are meaningful to you. So it may mean that you may not be able to do a task all at once, and that's okay as well. So we really want to make sure that you are saving your energy for things that are important to you, and just having that ability to potentially pace yourself through different activities. Again, as the occupational therapist who's with us today had also mentioned in her webinar, that equipment can also be very beneficial in order to help you save energy. Again, she may have mentioned, say, a wheelchair for the longer distances if you're having difficulty with walking the longer distances but still really enjoy being outside, or even positioning again. So thinking about when we are sitting in a chair, so I would want to potentially make sure that I'm well supported in my back and have the appropriate chair and equipment that's going to be beneficial for me. So shortness of breath, I'm just going to touch on this briefly because it is something that some of my patients do complain of. But again, it is very important to remember that everybody is different, and with MND, it is going to affect everybody differently. So some people may notice an onset of weakness in your arms or your legs, and no breathing issues until quite later on. Everybody's going to have a very different journey, but some people may notice some weakness in your core or your trunk area or breathing muscles and may experience shortness of breath. So again, some of these strategies are just quite generic, and it's really important to make sure you're speaking and trying to identify if any of these symptoms are occurring to you, and speak to a GP or your neurologist or a respiratory physician if you have one, or a healthcare professional who can help tailor any management plans according to you and what your needs are. So here I'm just going to discuss that, again, it can occur at any stage in MND, and it is important to pace yourself. So again, like I was saying before about saving your energy, it may be that you don't complete the task all in one go, and that's okay as well. So it may be a matter of just pacing yourself and doing half of an activity and then coming back to it later. I guess one example of this is, again, everybody's going to have different activities that are going to be important to you, or things that you do during the day. So if I was to give an example of pacing myself, I might think about if I was either doing the laundry or even meal prep, or having a shower. So if I think about laundry, I would, as an example, I may want to just fold half of it and then maybe come back to it a little bit later if I'm finding that it's causing some shortness of breath. So it's just a matter of just trying to listen to your body and do what you need to do in order to manage. Often, sometimes people can feel quite anxious when we are short of breath. So relaxation and breathing techniques can be very beneficial. And this, again, needs to be done with a health professional who can help you and teach you in terms of how you may be able to achieve this. But it's similar to a meditation or a relaxation, and the goal of it is to gain control again. So you're able to try and do some prolonged breathing techniques that may help you in order to reduce that feeling of anxiety or the ability or the inability to breathe, or that shortness of breath that you may experience. And another technique that can be very beneficial with shortness of breath, as you know, is a cough or clearing any secretion. So anyone who may have a lot of phlegm potentially in their chest, if they're unwell or just generally usually have a lot of saliva, then regular mouth cares or cough can also be beneficial. I think I've covered all of my points there. Yeah, okay. So positioning was another topic that I was just going to talk about. And again, this can be very different for everybody. So in terms of, I've just split it into 3 sections here. So if we're in bed or sitting or even standing. So when we're in bed, as I mentioned before, some people may have difficulty laying down flat. So some people may prefer to have themselves propped up with a few pillows. So you're laying in, rather than a flat position, a little bit higher, or using a foam wedges or sleeping in recliner chairs. Again, everybody's very different. That can be beneficial. In terms of sitting, so making sure you are sitting in a supported chair. So it's one with a high back if you need it, or even having some neck and head support as well can be beneficial. And some people may find using a wheelchair, especially for if you're having any limb weakness and the difficulty walking, and then it can allow you to be supported and go those longer distances, or go to the places that you would like to go and that are meaningful for you. And in this picture I've actually got on the screen here, that's a tilting wheelchair, which some of you may or may not have seen before, and it does allow a reclined position to be tilted back so we can rest our head and lateral neck and lateral thoracic supports. And when we're standing, so some people may find that using walking aids can be beneficial. Again, not for everybody, and again, it is important to discuss this with a healthcare professional if you're having difficulty with the standing. But often propping our arms can be beneficial if we're feeling shortness of breath or tired. So just as you probably already naturally do, it's one of those things I say, you can do this, and often my patients are already doing it because sometimes it can be a natural reaction to fatigue or shortness of breath. But propping our arms onto a table, which is where you may want to do some of your breathing techniques, and that actually allows us to use some of our other muscles to help us to breathe or position ourselves into better positions, or even just using our arms onto our knees when you're sitting. Again, everybody will be very different. So now I'm just going to briefly talk about lung function tests. Or this is something, again, that some people may have already done or not have done before, but it can be done at very different stages, and often it is prescribed by a healthcare professional or a medical professional. So what it is it's a test that allows us to look at how well your lungs work, but it also allows us to assess your ability of being able to take in a big breath in and also to breathe out forcefully. And this can actually give us a lot of different information in terms of also being helpful in determining if some enteral feeding would be beneficial, if we're going to use NIV, or if NIV, non-invasive ventilation, will be helpful for you, and also to determine the need to, if we need to help you with your cough. So I'll go over cough a little bit later on, but there's different parts of being able to cough, which is taking in those big breaths in before and also breathing out forcefully. So sometimes this may even be lung functions, may also be a test that a physiotherapist or somebody may perform for you. Initially, we may do a baseline test, so to see where your lungs are at that initial moment in time. And some follow-up tests may also be done, and the frequency of these tests or the reassessments of your lung function will often be determined by your doctor. So whether or not that's a neurologist or your respiratory doctor, and they may just want to monitor your lung function from that perspective. So what I did here is, in case nobody has actually done one of these before, is I've actually just given a quick little example of maybe what it may look like initially if you're asked to do a lung test. So here's just a very quick little video of me using our easy one here. So I'm using a peg there over my nose, and some people may use a mask instead of the breathing tube. And what I've done there is I've taken in a very big breath in, and then I have, then I have breathed out as fast and as hard as I could. And that actually allows us to see, one, what our functional vital capacity. So you may hear people mention FVCs, and it also allows us to assess the strength of that breath out, and assessing how strongly you can do that. So on to our next topic, we can then look at cough strength. So when we cough, or when we want to clear secretions from within the lungs, well, I say secretions, but what I mean is phlegm or saliva or anything that you may be noticing, so the phlegm in the lungs. And physiotherapists especially will aim to target or to help you with managing how to improve your cough. So when I talk about cough, we generally will look at different parts of the cough. So when we want to clear phlegm from the lungs, we need to take in a big breath in. Then we generally close the throat and we breathe out as hard as we can. And generally the goal of the physio treatment will vary depending on what your symptoms are and what your needs are. So some people may have more difficulty with the breath in, which we can observe when we are watching you breathe. And also other people may have difficulty with the breath out. And again, everybody is very different. So it is really important that we assess what part of your cough is not as strong and how we can potentially help you with that. So if you're having some difficulties with a cough, you may notice that you have the inability to clear phlegm. So it may feel like the phlegm is getting stuck in the chest, and you're unable to clear it or expectorate it out through the mouth. You may have trouble with sleeping, and also some reduced movement of the abdomen when you're trying to cough. So we do often use our tummy muscles when we want to force that air out and move that phlegm out towards our mouth. And it's important that when we cough, we're also thinking about our saving energies. So what we want to do is we want to help you determine what way we can help you cough without having to use too much energy. So without having to cough and cough and cough, we would more rather have an effective cough rather than lots of weaker coughs, which would be the goal of generally our treatment. So again, here, for any advice, it is important that you speak to your GP or doctor, neurologist, a respiratory physician, or physio if you're having any difficulties with these. What I'm going to go over next is just some cough options. So again, this is just some very generic information that may or may not be applicable to you. And you may already be having some of these treatments, or you may not, and that's okay. I guess the goal of my education today was to provide you some general information and mostly being able to identify when something may not be right, or when you may feel that you would benefit from some further management in a symptom that is impacting your quality of life or daily activities. So in this picture here on the left top corner, if you can all see that, it is actually a picture that I got from an article that I've had for quite some time, so from the Respiratory Care Journal, and what it is it's teaching carers. So when we do an assisted cough, sometimes that will be done by a physiotherapist, And sometimes physios may teach or educate your carer to help you with a cough as well. And again, it should always be prescribed by a physio or a healthcare professional. We don't usually recommend, it's good to have that carer training so they know where to put their hands and how they can help you, and potentially what positions you may want to be in when you're trying to cough, because like I said earlier, everybody is very different, and some people may find that you will be able to cough better in a completely upright position, so in a position that I'm sitting in now, or in a more supported position with your neck supported. So again, everybody's very different. And if I just go back briefly to the lung tests, sorry, I've just had a thought that I wanted to mention, is that some people may ask you to do assessments in these different positions as well. So you may actually do a test in an upright position or laying down or reclined. So that's just giving us a little bit of information about how well your lungs work in these different positions. So going back to the assisted cough, it's just where someone, physiotherapist or carer, if they're trained, anybody who's trained, will give you a little bit of support to help you force air up and move that phlegm towards your mouth. So positioning, as I mentioned earlier, can be helpful if we need to have a little bit of neck and head support, well supported in the back, or either in upright or reclined positions, or a forward sitting position may also be helpful. It is really important to consider regular oral hygiene and mouth care. So we want to try and keep our mouth clean, and if saliva especially is an issue for you, then this is also very important to be able to keep that mouth clean and prevent it from going into the lungs. Some people do find home suction kits helpful. Again, home suction kits and even the cough assist that I will be talking about are not mandatory daily routines. So again, they do need to be prescribed, and again, they do need to be prescribed to tailor what your needs are, and if it's appropriate. So I'll talk about the cough assist now. And again, some of you may have heard of this and some of you may not have. And generally what it is it's just it's a mask with a small pump, so similar to our NIVs, I guess. I've just got a mask here. So if I was to think about a mask, it would only be something like this that we may use if we're unable to make a good seal with our mouth. And what it generally will do is it will just be attached to a tube with a pump. And the goal of it is to help us, again, everybody is very different. Maybe you're having trouble with a breath in. So it may give you a little bit of support for your breath in, but it's something that we would have to determine if we're able to breathe with it. So you want it to be effective. So there can be different reasons why it may not be appropriate for you, but it may also be appropriate, but that needs to be discussed with a physiotherapist or a respiratory consultant first. And then the other part of the cough assist is the breath out. So the goal of that is to help you. It's more of a negative pressure. So we think about a suck motion. It will help move that phlegm closer towards your mouth. And we try and target the pressures that we might use with a cough assist that you can tolerate and that are appropriate for you. So the prescription part of that is very important and can be very helpful in terms of the effectiveness of the management. So does need to be prescribed. I've just mentioned here LVR, and that's more of a lung volume recruitment technique that you may have actually already done with a physio maybe before you did the cough assist, because what that actually does is it helps us take in a breath in. So it's more of a, I've got the bag, but more of a bag similar situation where we're helping us to recruit air in our lungs, which we need as part of our cough. So we need to taking that big breath before we force the air out, and sometimes that can just help you take in that big breath. But again, it's not for everybody, so it's also very important that you don't try to use these without it being prescribed, because you don't want to put yourself or anybody else at risk as well. So they should be prescribed by a healthcare professional. I've just gone completely off topic, so I'm sure I had a few other signs, but the only other thing that I was just going to mention, if I just jump back to cough strength, is that often you may find that some people will test your cough, test your cough with what we call a peak cough flow meter, or they also may use the easy one that was in that video, so the test where you breathe out as hard and as fast as you can, or we may use one of these. So this is a peak cough flow, and you may or may not see these. So this is where we actually ask you to cough through this, and we generally do it with a mask. So you can have this on here. So it's more of a gauge in terms of how strong you can cough, and maybe whether or not we need to determine if we need to add anything in to help your cough be more effective in trying to clear secretions. So that was just my little point there. All right, and we're on to non-invasive ventilation, or NIV. So NIV, the goal of NIV generally is to provide a positive pressure. So similar to how I was talking about the cough assist, instead sometimes this one may be more of a full face mask, but there are different interfaces that can be used, and all of the different options need to be discussed with your respiratory consultant or sleep doctor in terms of being able to find what's more comfortable for you. So this is just more one example of a face mask, or one that we had here in our teaching boxes. So, and it's more just a face mask that goes onto the face, and it's usually attached to a pipe, so one of our tubings, and then it will be attached to a small pump. And the goal of the NIV is to help you keep your airways open so we can breathe, and help you breathe out carbon dioxide. So as I was saying before, there are different interfaces that can be used. So the full face mask or a nasal mask, everybody's very different. Some people may have mouthpieces as well. And ideally, the goal of the NIV is to help provide some relief from fatigue, shortness of breath, or maybe even disturbed sleep. And ideally, the NIV is something that is not worn 24/7. So we don't want to wear it all day and all night, especially not initially. So you may find that it's a slow progression of how long you wear that, and it does need to be prescribed by a medical physician. And your neurologist or GP or respiratory doctor, if you have one, may refer to a sleep study in order to work out what pressures are going to be helpful for you, because everybody is very different. So again, it's not one quick fix for everybody. Everybody breathes differently. And so the goal of the machine is to just provide a bit of support to help you breathe on your own, but just allows us to probably have some bigger volumes with our breathing, if you're finding that breathing is a little bit more shallow. So it is prescribed, and some people may use that lung function test or the easy one to help us gauge if that would be beneficial for you. You may do some more formal testing. So I know that in our hospital we have some lung function test rooms that you may breathe into a bigger machine, and some people, they may ask you to stay overnight at the hospital or somewhere, and you can get a sleep test done. And again, it's not for everybody, but that's just one option that may be discussed with you if your doctor is thinking that NIV might be helpful to help you with your sleep and help you with your symptoms of fatigue and shortness of breath and waking up in the middle of the night. And NIV, it doesn't always, the symptoms of any problems with breathing, again, it's not one fix for everything. And we may use NIV in combination with other therapies or medications that can help you with your symptoms. So often, again, this may be in discussion with your doctor or a palliative care team or with your respiratory consultant, anyone who's involved in your care, because you may find that even just looking at the wealth of knowledge and the different people that are involved in this organisation helps you appreciate that there are lots of people that are going to be involved in your care to help you manage your symptoms, but it's just being able to highlight maybe what other symptoms are you experiencing and how we can probably help you with that. So you may also hear different types of NIV. So often some people you might hear the word CPAP or BiPAP or bi-level, and these are just different types. So often when you need to have some NIV, they may do that sleep test, and that will determine what type of NIV would be beneficial for you. Other tests that might be done that can help determine this are they may take some blood to assess how much oxygen and carbon dioxide they have. They may monitor your oxygen levels through your finger, or the sleep test. So again, there's lots of different tests that could be done. And one question that often I find gets asked occasionally is, why not just use oxygen? So if I'm feeling short of breath, or I'm feeling quite fatigued and I have some respiratory muscle weakness, why not just pop some oxygen on? And that's with MND, it's generally the symptoms that you may experience from the muscles becoming a little bit weaker. And as a result, it's not an issue with the lungs and us being able to absorb the oxygen into our blood, but rather more the flow of air, which is why often the NIV. And some people may need oxygen at some point if you do need it, but initially, generally the goal of the NIV, we're not providing oxygen, we're just using the room air that we're all breathing, that you're having that little bit of support with. And I think that was most of mine. So these are just some resources that I know you already probably know, but I actually did find them very helpful, and I probably use them as well in terms of with my patients, in terms of just having some resources for symptom management, and they do discuss some topics that I have discussed today, and these are just a few references, and that's me done. Do you have any questions?
So, thank you very much, Sarah. Can you just allocate the host back to me so I can unmute everybody?
Absolutely.
And unshare your screen. Excellent. All right, so let's get everybody back on the screen. There we go. Okay, excellent. So now everybody is unmuted. Get everyone's faces back on the screen. Does anyone have, some people aren't unmuted because you must have muted yourself. So if you want to ask a question, you'll have to take yourself off mute. Does anyone have any questions that they would like to ask at this stage?
The one question I wouldn't mind asking, I've had a lung test and it was good, but I'm experiencing a lot of pain in my lower back and my legs. Is that common, or and can I do something about it through exercise or whatever?
Yeah, I do. It's a good question in terms of exercise and breathing. So if you've had your lung test done, then often they will reassess that as a doctor feels like it's appropriate. I guess in terms of exercise and the shortness of breath, it's very different for everybody. So I guess right now it's quite difficult to give you specific advice in regards to what is going to be the best option for you. But what I do encourage you to do is to discuss it with anyone who is involved in your care, to help try and make a more of an individualized management plan. I guess that exercise, you may even be having some other webinars and information about exercise, because I guess we know exercise can help us, but also we want to be able to manage any fatigue that may be associated with any overexertion. So within itself, exercise is quite a nice big topic. And I'm sorry I can't give you specific advice right now, but I do encourage you to speak to somebody, or your GP or a physio if you have somebody at the moment, to try and help manage your pain, and then maybe help improve your function.
Yeah.
Is that helpful? Sorry.
Okay, and Sam, just to add to that, we do have, I can't remember the dates off the top of my head, but we do have a physio presentation around exercise and MND, I think in 4 weeks' time, but don't hold me to that. But I will obviously send out the invite and the details closer to the time.
I'd be looking forward to that, because I got a few questions. I try and keep myself as motivated as I can, but the pain often slows you right down.
Yeah. Any other questions?
Sarah, I had a question. I tried typing and I don't know if you got it, but it was to do with weather. Do you find that extremes of weather can affect respiratory rate for people? Or?
Absolutely, yeah. The amount of humidity in air as well. So some people may find dry air, especially if you're experiencing dry mouth, and if we're drying any if we're breathing in dry air, then it may cause some thickened secretions potentially. Again, everybody's very different, but some people do find that using a humidifier within the house helps. And again, it's just a matter of tailoring your symptoms and trying to find the best way to manage that. So it is often something that may be helpful, and you often may find that after a hot shower even, so if we think about when we shower, the hot mist may actually help us to clear any phlegm that may be there, and that's because of the humidification in the air that allows us to help us cough up any phlegm. So sometimes we know that the weather changes, so everybody can react differently to weather and temperature and the amount of humidity in the air, but it can definitely probably affect people in different ways. So it's definitely something to consider, that it may be contributing to thickened secretions, and discussing that with someone to find how you can improve that.
Andrew, I think you were going to ask a question before, is that right?
So I was just going to ask, when is MND Queensland likely to employ a physio?
That is a great question.
Great question.
Yeah. So you'd be aware that initially the MND associations were not designed to provide clinical care. And it was only really as a response to seeing, I guess, with the introduction of the NDIS, and therefore people's opportunity to select just the most local clinical services that have immediate availability. What we saw is, I guess, a diversity in terms of the allied health professionals that people were using, and not always those with the MND experience, and reduced access to those more experienced professionals through the health system. That led us to the view that we really wanted people to have access to MND specialists, and that's why we went down the OT route. In order for us to expand those clinical services further, they have to be sustainable, because we don't get any real government funding at this point in time. With COVID, that has changed ever so slightly, but certainly not to the point that we could warrant growing our team much beyond what it currently is. If we are in a position where we can sustain the clinical services that we're offering from in occupational therapy, then we would be looking at the next highest need, and certainly speech therapy and physiotherapy, respiratory physiotherapy particularly, is a high demand. So I'm hoping it will happen, but it will very much come down to either identifying a funding source or us finding a way to make it self-sustainable from the income it can generate. Any other questions? Maureen, you're on. No, you.
Oh, you're going.
You're on mute there, Maureen, so I can just see you waving, but I think you're saying you don't have a question. Okay, anyone else? I do have a question I'd like to ask then, Sarah, and Sarah and I were talking about this briefly before the presentation started, but I thought it would be interesting for everyone to hear the answer. So we were discussing the fact that, as Sarah pointed out, respiratory symptoms or shortness of breath and fatigue can often happen before mobility issues occur. So people could still be walking but experiencing some shortness of breath. And the non-invasive ventilation that was in your presentation there is obviously not particularly mobile. So what are the options to avoid people having to choose between breathing or mobility?
Yes, well, I guess as we were talking before, the prescription, or when we need to wear the NIV initially, is often prescribed by a doctor and the respiratory consultants. And so you may find that by wearing it in the evenings or when we're sleeping, then you may improve your levels of, or have less fatigue and shortness of breath when you are during the day, which helps you achieve more activities potentially. So that can improve your level or ability to be able to engage in things that are important to you during the day. But we also do have, I guess, if breathing is difficult for you in terms of when you're moving, then there are options of different portable NIVs. But again, it will all depend on when or what symptoms you're having, and they will often perform different tests. So they may check as I mentioned before, say a blood test to have a look at your levels of oxygen and carbon dioxide in your blood, to see whether or not you may need to wear it more often or not. So it may be a gradual progression. Some people may need it a little bit more than others, and that's okay. It just depends on what you're determining with your doctor and discuss those symptoms. So it is important to raise the fact that if you're unable to walk, say, those longer distance or get outside, because you're too short of breath, then discussing that with your doctor or respiratory consultant or GP, if that's something that's happening with you, because there will be other options.
And am I right in thinking that technology has advanced to the point that it's literally, you can get something this big and weighs a kilo that will support your breathing whilst you're mobilizing?
Yes, the times have changed where we don't have to keep it plugged into a wall at all times now. So often they can have the battery packages, and he's got portable oxygen sats there. Great. And that was one of the tests, yeah.
It's a very simple device.
Very, yes. That's
Okay,
great.
at the moment.
Ah.
Very handy if you're going in an airplane as well. So you can check you're not too low.
Yes. Yes, that's very good. Very portable if you need it. Yeah,
that's right.
Yes, we're very lucky now with technology advancing. There are different options that hopefully will be able to suit different people for different needs at different stages in their journey.
Excellent. Okay, any last questions before we wrap up? No? All right, then. Sorry, was someone going to ask a question then? No?
No, thank you very much, Sarah. I'll have to watch it all again.
Oh, gosh. Well, thanks very much for tuning in. I really appreciate the opportunity. It was lovely to meet you all. Yeah. And yes, thank you again.
Yeah, look, we've got a thank you from someone there. So this recording will be available on the website later on today, I would imagine, or first thing tomorrow, if not today. But yeah, on behalf of all of us at MND Queensland, thank you so much, Sarah, and thank you to your employers, Queensland Health, for letting you spend the time with us today. We very much appreciate it. Been great to see you all. I hope you found it useful. I've certainly learned some things. It was particularly useful to see what that lung function test actually consists of, I think. So we talk about that on a regular basis with people, but obviously we're not usually part of those tests. So it was interesting to see that. So thank you again. If anyone thinks of any questions, I'm sure Sarah would be happy for me to forward them on to her. So feel free to email me if you think of something later down the line. All right, well, I'll let you all go. Nice to see you all. Enjoy the rest of the day.
Bye.